Hello guys, so welcome back. So today we shall be discussing one of the most important topic, which is this disease is worldwide. This disease spreads worldwide, that is pneumonia, which you can see most commonly in your clinics, right? And what is the bacteria that is responsible for causing pneumonia? That is nothing but your Streptococcus pneumoniae bacteria. So we shall be discussing all the microbiological aspects regarding this Streptococcus pneumoniae. So let us start with the anatomical microbiology, the structure of Streptococcus pneumoniae, and then we shall discuss it as further, okay? First of all, look at the morphology of this bacteria. When you look at the morphology of this bacteria, for example, let us choose one bacteria in a slide. This is the sputum which we obtained from a patient suffering from pneumonia, right? When you look microscopically into the sputum, we found this, okay? When you look here, you can find small 3 circular bacteria over here, 3 or 4 circular bacteria over here, right? If they are circular, they are called as cocci, and if they are arranged in chain, they are called as strept. So it is called as a streptococci, and this bacteria is Streptococcus pneumoniae. So if I ask you, if in the exam they ask you what is the exact shape of Streptococcus pneumoniae, for example, let us say if I ask you what is the shape of Clostridium, you will tell it is comma shaped. In the same way, what is the shape of Streptococcus pneumoniae, then you should answer that it is bullet shaped. Bullet shaped, or also called as lancet shaped. Lancet shaped bacteria. Lancet shaped bacteria, right? Let us go into furthermore morphological features. The first thing which you can see here is Streptococci has got a thick peptidoglycan layer. In all the lectures of microbiology, I have been teaching you that any bacteria, if it is having thick peptidoglycan layer, it is called as gram-positive bacteria. Any bacteria that is having thin peptidoglycan layer, it is called as gram-negative bacteria. And again, I am telling you not to worry. I'll make a special video where I'll be teaching you what are all the bacteria of gram-positive and how to remember them, and the same with the gram-negative bacteria. So this is a gram-positive bacteria. So if I am telling you this is a gram-positive bacteria, so it should have what? It should have a thick peptidoglycan layer. So if it is having a thick peptidoglycan layer, visually how can I see? How can I see is that gram-positive bacteria, they stain violet in color, whereas gram-negative bacteria, they stain purple to pink in color. Okay, fine. Now the next morphological feature is this bacteria, unlike the Clostridium species, okay, so this bacteria do not release spores, but whereas Clostridium bacteria, they release spores. Now why are you discussing about spores? Because you know Clostridium species, these bacteria release spores. That is why they are called as spore forming bacteria, and these spores are so toxic that they can damage your nervous system, and that is why these spores are also called as neurotoxic spores. Okay, so every bacteria, whenever you are discussing, you have to know whether it is spore releasing or non-spore releasing. But thank God that this bacteria, that is Streptococcus pneumoniae, is a non-spore releasing bacteria, right? It is a non-sporing bacteria. And do you find in this bacteria, are there any flagella like things? No, I just find a circular things here, that's it. I don't find any flagella, I don't find any cilia. So when I don't have any flagella or cilia, do you think I can move? Can this bacteria move? No. So can I call it as a non-motile bacteria? Yes, this is called as a non-motile bacteria. And later on, I will be showing you the zoom picture of this bacteria. But for now, what you need to know is that this bacteria, covering this bacteria, there is a capsule. So those bacteria which have capsule are called as capsulated organisms. Why are you discussing about capsule? The reason why I am discussing about capsule is capsule is the most important virulent factor. Why? I will be discussing it in a minute. But for now, what you need to know is organisms which are capsulated are virulent. Organisms which don't have a capsulated are called as non-capsulated organisms which are not virulent. So this organism over here is virulent. Virulent organism. Why? Because it is capsulated. Because it is capsulated. Another important thing, Another important morphological feature about this Streptococcus pneumoniae is that this Streptococcus pneumoniae can live in the presence of oxygen, in the absence of oxygen as well. So those organisms which can live both in presence and absence of oxygen are called as facultative anaerobes. Organisms which can live only and only in the presence of oxygen, which cannot survive without oxygen, right? These organisms are called as obligatory anaerobes. So this organism can live with the help, without the help of oxygen. So it is called as facultative anaerobe. Okay, so this organism is called as facultative anaerobe. Now let us look, where does this organism basically resides in your body? Is this organism coming from outside, or it is normally present, normal habitant of your body or not? And before that, we shall overall club up all the important morphological features. First thing, I told you it is gram-positive. Why? Because it has got a thick peptidoglycan layer. It is non-sporing and non-motile bacteria. You knew it. It is a bullet-shaped bacteria, we have already discussed, or bullet-shaped or lancet-shaped bacteria, right? And it is a capsulated organism. Capsule is the most important It is the most important virulent factor. Alright, let us look the colonization of this bacteria, where this bacteria normally resides. If you look at this picture over here, right, this bacteria is a normal habitant of your upper respiratory tract. Even in your nasopharynx, let me write it down. Even in your nasopharynx, even in your respiratory tract, you have got the mucus layer, right? Globular cells are releasing mucus. So in your respiratory tract, you have got the mucus layer. So even in the mucus layer of what? We have got two respiratory tracts, upper respiratory and lower respiratory. I am talking about upper respiratory tract. Okay. And another important morphological feature which I forgot to mention is that regarding the colonization, these are the two common places where the bacteria colonizes. But regarding one morphological feature which I forgot to mention is that this bacteria can live in a normal temperature, like let us say 30 to 35 degrees centigrade temperature. So it is an intermediate temperature, right? Not too high, not too low. It is an intermediate temperature. So it is called as mesophilic organism. Mesophilic organisms are those organisms which can live in a normal temperature. So let me write it here itself. This bacteria is mesophilic. Why? It can live at a temperature of 30 degrees centigrade to 35 degrees centigrade. Okay, hope you understood now. Another important thing which you need to know is regarding the properties of this bacteria. Every bacteria has got its own properties. I have explained these properties in very much detail in every video, and again I am explaining the same properties in very much detail. Okay, so regarding the first property, you can see that this bacteria is alpha hemolytic. So I hope those students who have watched all my videos knew very well what is alpha hemolytic, beta hemolytic and gamma hemolytic. But those students who are watching this video for the first time, I am going to explain you completely about what is alpha, beta and gamma hemolysis. You can forward the video if you have already knew this thing. Fine. Regarding the hemolysis, every bacteria has some property. Like some bacteria are alpha hemolytic bacteria, some bacteria are beta hemolytic, some bacteria are gamma hemolytic. First of all, let us differentiate the examples, then discuss the concept in detail. So, what are the examples of alpha hemolytic bacteria? One is S. pneumoniae, that is Streptococcus pneumoniae bacteria is alpha hemolytic, right? The current topic is alpha hemolytic. Next one is Streptococcus viridans. It is also alpha hemolytic. When you come to beta hemolytic, what are the bacteria which are beta hemolytic? Streptococcus pyogenes. Streptococcus pyogenes is beta hemolytic, and Streptococcus agalactiae. Agalactiae is also beta hemolytic. When it comes to gamma hemolytic, there is only one group, that is Enterococci. So, Enterococcus bacteria are gamma hemolytic. Okay, so you just have to remember this slide. There is no concept in this slide. I'll explain you the concept in a minute. But before that, one thing, what are the examples of alpha? What are the examples of beta? What are the examples of gamma? And another extra thing which I want to add here is, one very important thing which I want to add here is, Streptococcus pneumoniae is optochin sensitive, whereas Streptococcus virulence is optochin resistance. What is this optochin? Optochin is an antibiotic. What is meant by optochin resistant, optochin sensitive? I'll be discussing in this video, but in the previous videos also I have very clearly covered what is that with the picture. So please watch the previous videos before watching this video. Okay. Now, Streptococcus pneumoniae is optochin sensitive. Streptococcus virulence is optochin resistant. In the same way, Streptococcus pyogenes is bacitracin sensitive. Streptococcus agalactius bacitracin resistance. Even I have discussed this in their respective videos. What is this bacitracin sensitivity or bacitracin resistance? Is that bacitracin is an antibiotic. Okay, so some are sensitive to antibiotics, some are not sensitive to antibiotics. So that is the same thing. Optochin and bacitracin, both of them are antibiotics. The same thing. Okay. Now, another important property. First property is it is alpha hemolytic. Now the next property is this bacteria. We are discussing the same property. It is not the next property. As I already promised you that I will discuss that this bacteria is alpha hemolytic, right? Let me check. This bacteria is alpha hemolytic. Yes, this bacteria is alpha hemolytic. Then what is beta hemolytic? What is gamma hemolytic? First of all, let us discuss about beta hemolysis. You can see a letter here, beta. This is beta, right? I hope you can see. This beta, what I have done is that I have taken an agar plate, blood agar plate. Why I am calling it as blood? Because in that I have added sheep RBC. Now I have drawn the shape of some bacteria. I have taken some bacteria and I have drawn in the shape of beta. Okay, so this beta letter which you can see exactly has having that bacteria. Okay, now this bacteria releases some toxin. Let us say this bacteria is beta hemolytic. So this bacteria is releasing a toxin called as beta hemolysin. And this beta hemolysin will cut down, will cause lysis or hemolysis of all the bacteria surrounding it. That is the reason why surrounding this bacteria, do you see any red color? No, I can see a golden yellow color, a bright zone, a vibrant zone surrounding this bacteria. Why? Because surrounding this bacteria, this toxin has killed down all the RBC, has got complete hemolysis of all the RBC. If you put 100 RBC surrounding this beta, all the 100 RBC have been hemolyzed. All the 100 RBC have been lysed. That is why you cannot see any RBC surrounding it. So can I call beta hemolysis as complete hemolysis? Yes. This beta hemolysis is also called as complete hemolysis. So which bacteria will perform this complete hemolysis? In the previous slide I have given you the examples. Now let us go compare with alpha and gamma. Surrounding the alpha you find pale zone, but surrounding gamma, do you find any pale zone? No. Why? Because surrounding alpha, if you put 100 RBC surrounding the alpha, only 50 RBC have been broken down. It means 50 RBC have been hemolyzed. Okay? But surrounding gamma, as there is no pale zone, it means if you are putting 100 RBC, out of 100, not even a single RBC have been broken down. There is no hemolysis of even a single RBC. So, can I call alpha hemolysis as partial hemolysis? Can I call gamma hemolysis as no hemolysis or incomplete hemolysis? Yes, alpha hemolysis is also called as partial hemolysis. Why partial? Because only few RBC have been broken down. There is lysis of only few RBC. Partial hemolysis. Gamma hemolysis are absolutely no hemolysis. And as you can see the color of alpha hemolysis, which color is it? Isn't it green? So can I call it as green hemolysis? I'll tell you in a minute why it is green in color. But can I call it as green hemolysis now? Yes. Or it is also called as green hemolysis. Why is it green? Why you are calling it as green hemolysis? Because you can see an RBC there. Is the RBC shape correct? No, the RBC is broken down. There is lysis of the RBC. Always remember guys, every RBC has got hemoglobin in it. Okay, let me use another color. Right, look at this RBC. This RBC is broken, right? Because in this RBC, there is hemoglobin in it, right? So when the RBC is broken down, obviously the hemoglobin will be released outside. Hemoglobin has got heme and globulin. So hemoglobin has got two things. One is called as heme, another one is called as globulin. And what is globulin? Globulin is a protein which will be broken down to amino acids. But what is heme? Heme will be further converted into biliverdin. So biliverdin is in which color? Biliverdin is green color. That is why this hemolysis, which is also called as alpha hemolysis, is also called as green hemolysis. Fine. This alpha hemolysis is also called as green hemolysis. Right. Another important thing which I want to discuss is, look at the capsule over here. So surrounding this Streptococcus pneumoniae, so this bacteria Streptococcus pneumoniae, surrounding this you see a double layered capsule. So this is called as capsule. As I already told you that if organisms which are having capsule are more virulent, and organisms which don't have capsule are called as less virulent organisms. So tell me, is this organism virulent or non-virulent? It is a virulent organism. It is a virulent organism. But microscopically, when you look at this bacteria, right, this is how it looks. This is a bacteria. This is a bacteria. Surrounding this, there is a capsule. This is a bacteria. This is a bacteria. Surrounding this, there is capsule. This is a slide. So what is this called as? This is called as capsule. This is called as capsule of the bacteria. Right? I hope you understood this. Very good. Now, another important thing which I want to mention here is that organisms which are not capsulated are called as avirulent. Let me write down that word. Non-capsulated are avirulent. Non-capsulated are avirulent. Fine. You told me enough about capsulated organisms and non-capsulated organisms. That capsulated organisms are virulent and non-capsulated organisms are non-virulent. Right? Can you tell me what is the use of a capsule? What is the use of a capsule? Is that why is the capsule virulent? Why should it be virulent? What is the use? The use is that, first thing, with the help of the capsule, when the bacteria enters inside your body, with the help of the capsule, the bacteria attaches to the surface of the host. Bacteria needs proper attachment. Bacteria is circular, it can roll up and go out. So bacteria needs a proper attachment. So for that attachment, you need a capsule. So can I write point number 1 that this is responsible to promote bacterial adhesion. And second important thing is, by chance, if any phagocyte is coming towards this bacteria and trying to engulf this bacteria, this capsule prevents that phagocytosis. So can I call it as defense against phagocytosis? This bacteria is responsible for defense against this phagocytosis. So you very well knew now what is the use of the capsule. It has got two functions. One is promote bacterial adhesion, another one is defense against phagocytosis. The next property, first property was, what was the first property? It is alpha hemolytic. It is alpha hemolytic, means this bacteria is performing partial hemolysis or green hemolysis. Point number 2 was, this bacteria is having capsule, so it is an encapsulated organism which is more virulent. Point number 3 is, it is optogen sensitive. Why this bacteria has to be called as optogen sensitive? Because look at this slide over here, right? This slide is red in color because I have taken a sheep blood into this. Now in this, I have taken a slide like this, right? I have taken a slide like this. I have divided this slide into two halves like this. This is called as This is called as the right half. This is called as the left half. In the right half, I have added a bacteria called as Streptococcus mittens. Streptococcus mitis. Okay. I have added one bacteria on the right side. I have added another bacteria on the left side. So look at this slide here. I have divided this slide into two halves. On the right side, I have added Streptococcus mitis. On the left side, I have added Streptococcus pneumoniae. Now, after adding this, what did I do? I have kept a disc, white color disc called as autolysin disc. Autolysin is nothing but an antibiotic. I have kept a disc here, a small disc which is an antibiotic on the right side. Yeah, I have placed a small disc, autolysin, which is an antibiotic on the left side. What has happened? On the right side, on the left side, look at the left side where Streptococcus pneumoniae is there. On the left side, look where Streptococcus pneumoniae is there. Surrounding this antibiotic, is there any bacteria? No. Do you see a zone, a very clear zone there? This is called as zone of bacterial inhibition. Antibiotics are responsible for killing the bacteria. So surrounding this autolysin disc, surrounding this bacteria, all these and surrounding this antibiotic disc, all the bacteria have been dead. All the growth of the bacteria have been inhibited. So this is called as zone of bacterial inhibition. Zone of bacterial growth inhibition. So when this bacteria has been dead, can I call this bacteria is very sensitive to autolysin? Very sensitive to a antibiotic called as autolysin? Yes. So Streptococcus pneumoniae is autolysin sensitive. Autolysin sensitive. But when you go on to the right side, look at the autolysin disc there. Surrounding the disc, is there any growth inhibition? No. So can I call Streptococcus mitis is not afraid of antibiotic, called as autolysin? Yes. So Streptococcus mitis is autolysin resistant. Right? Another important thing which you need to know, that property number 3 is Streptococcus pneumoniae is autolysin sensitive. Property number 4 is that let us check its capsule. What did I tell you? Surrounding the bacteria, you have got a capsule, right? So how will I know? By looking it, will I know? No. There is a special reaction called as squilling reaction. What is this squilling reaction? Is that, for example, let us say I am suffering from pneumonia. Now, I will throw my sputum. I will take out my sputum and put it in a disc, in an agar plate. Okay. Now, I will add antibodies to it. Exactly speaking, I will have anti-serum. Anti-serum has got antibodies, right? So, I will add antibodies to it. When I add antibodies, if in that sputum, if I have Streptococcus pneumoniae, then I will have a capsule. If I will have a capsule, these antibodies will attach to that capsule. When these antibodies will attach to that capsule, the capsule will swell up. You can see the picture here. This is a bacteria. Surrounding this bacteria, you see the capsule has swollen up. Look at this picture over here. These are the two bacteria. Surrounding this bacteria, you can see a white space. White space is nothing but the swollen capsule. Look at the real slide here. You see this bacteria over here. Surrounding this, there is swollen capsule. Even here, bacteria in the center, surrounding this, a swollen capsule. Why the capsule has been swollen? It is squilling reaction positive. So this is property number 4. When you come to property number 5 is that this bacteria is catalase negative, and every lecture I have explained you what is catalase. Even now I am going to explain you clearly what is catalase. If a bacteria is releasing catalase, this catalase enzyme will convert H2O2 means hydrogen peroxide, H2O2 into foam. What is foam? Foam is consisting of water plus half mole of oxygen. That what forms the foam. If a bacteria is releasing catalase, it is called as catalase positive. If a bacteria is not releasing catalase, it is called as catalase negative. So unfortunately, this bacteria is not releasing catalase. So this is called as catalase negative organism. One important thing I'm telling you guys, whenever you find deep cut wounds, never ever add hydrogen peroxide, because if, for example, if I met with an accident and my femoral artery got cut, if you add hydrogen peroxide, then in my femoral artery, hydrogen peroxide is going to convert into water and foam. I mean, water and half mole of oxygen. So oxygen bubbles start appearing in my femoral artery. From there, if they enter into my lungs, then I will die having pulmonary embolism. Okay, never ever in your clinics, never ever add hydrogen peroxide to deep cut wounds. Only add hydrogen peroxide to superficial wounds. Okay, but anyways, you need 10 ml of oxygen to cause an air embolism. So nothing to worry about that. So property number 5, that this bacteria is catalase negative bacteria. Okay.